Good morning everyone. Today I will introduce about the health policy. So my name is Muhammad Azril bin Khairul Anwar. First, the NTCP was introduced in 2003 with the main objective of reducing smoking rates and protecting the health of the Malaysian population. Smoking is one of the major causes of preventable diseases worldwide. It can lead to serious health problems such as lung cancer, heart disease, stroke, and respiratory illnesses. Because of these harmful effects, the government introduced this policy to encourage healthier lifestyle and reduce the number of smokers in the country. In addition, the policy does not only focus on smokers but also on protecting non-smokers from secondhand smoke. Exposure to secondhand smoke can also cause serious health problems, especially among children, pregnant women, and elderly people. Therefore, the NTCP helps create safer public environments through smoking restriction and awareness campaigns. By reducing smoking related illnesses, the policy can also help reduce healthcare costs and lessen the burden on hospitals and healthcare services in Malaysia. Next, the policy is strengthened through global alignment with the World Health Organization guidelines and the Framework Convention on Tobacco Control, also known as the FCTC, which Malaysia ratified in 2005. This convention provides international standards and strategies for tobacco control. By following WHO recommendation, Malaysia is able to improve disease prevention efforts and strengthen public health protection. Furthermore, global cooperation allows Malaysia to adopt effective tobacco control measures that have been successfully implemented in other countries. These measures include health warnings on cigarette packaging, restriction on tobacco advertising, public awareness campaigns, and smoke-free public areas. This alignment with global standard also demonstrate Malaysia's commitment to creating a healthier society and reducing smoking-related diseases for future generations. Lastly, the NTCP uses a top-down governance approach where the government plays a major role in designing, implementing, and enforcing tobacco control policies. Government agencies are responsible for monitoring smoking regulation, enforcing smoking bans, and ensuring compliance with tobacco control laws. This strong governance style is important because it helps ensure that policies are implemented effectively across the country.
Hello everyone, my name is Nabi Nazmi bin Maksuti. So I will continue the presentation. I will explain to you guys about the policy problems. So there are four main points of this policy problem, which is the first one is public health crisis. Second one is economic and healthcare burden. Three is the threats to the vulnerable groups. And the last one is the illegal market. Okay, so in order for us to understand why this policy is established or important to us, because first one we need to look the scale of the problem. Why of the establishment of this policy? The first one is public health crisis. So you know that tobacco use is currently the leading cause of preventable death and disease in Malaysia, because it contributing significantly to lung cancer, heart disease, and stroke. And this has creates a massive burden on our healthcare system, because the government need to pay the high cost of the long-term treatments of their citizens. And beyond health itself, it can impact our economy, because smoking-related illnesses can lead to absenteeism and premature death, which directly reduces our national productivity, because people who have the illnesses that related to the smoke cannot done their job properly. And the third one is the threats for the vulnerable groups. There are two groups. The first one is the youth, or we can call it teenager, and the second one is the non-smokers. For the youth, they are often start smoking because due to peer pressure, which mean that because their friends lead them to do that, and because of that, it has led them to have a lifelong addiction to smoking, and when they are already adult, it will lead to chronic health issues. Second one is non-smokers. People who are non-smokers always exposed to the dangers of the secondhand smoke, especially in public places, and even at home if their parents or their family are smoking. And this has putting them at risk for respiratory and cardiovascular diseases. And finally, the illegal market. This issue is complicated by a large illegal cigarette market because these cheap illicit products can undermine the government taxation efforts and make tobacco far too accessible, especially to young people and lower income groups. So the effort of the government has, maybe I can say that there has no effects because of this illegal market, because people still can buy the cheap cigarettes. Okay, so now moving on to the next slide, I will explain to you guys about the policy objective. There are four objectives. The first one is primary mandate. Second one is to reduce the prevalence. The third one is environmental protection. And the fourth one is long-term vision. So, basically, the government has established a clear objective to counter all these issues that I already explained before. The primary mandate of the National Tobacco Control Policy is to prevent, protect, and reduce harm, especially from tobacco consumption. And in order to achieve all of this, the policy uses a mix of regulatory, educational, and preventative initiative. The goal is to encourage current smokers to quit while aggressively discouraging the non-smoker and the younger generation from even starting to smoke. And then, a major pillar of this strategy is the establishment of the smoke-free zones in such as workplaces, restaurants, and healthcare facilities. And we can see also at the university for the younger generation, right? This is essential for safeguarding the vulnerable groups, such as children, pregnant women, and the non-smokers. Because the toxic effects of the second-hand smoke can become more dangerous than people that smoke itself. And the last one, by raising the awareness and limiting access to tobacco, the policy aims to promote healthier lifestyle to their citizens. This long-term vision is to enhance the quality of life for all Malaysians and ensure a safer, smoke-free environment for both current and future generations.
Bismillahirrahmanirrahim. My name is Muhammad Shabri, and now I will explain the strategies used by the government to reduce smoking and improve public health. So, this strategy involves several important policies instruments, such as including regulatory measure, economic measure, and public support initiative. So, the first one is the government use regulatory measure to control smoking activities in society. One of the main strategies is to enforcement of smoke-free zone in public areas such as restaurants, schools, office, and public transportation area. So the purpose of this smoke-free zone is not only to protect non-smokers from the harmful effect of second-hand smoke, but also to reduce the social acceptance of smoking in public place. Besides that, the government also controls the sale of tobacco product through licensing system and regulation. Retailers must follow strict rules when selling cigarettes, especially to prevent access by minor or underage individual. So this is important because many smokers begin smoking at a young age. So reducing accessibility can help prevent new smokers from developing the habit. So another important regulatory measure is the use of graphic health warning on cigarette packaging. The warning label contains shocking image and health information related to disease caused by the smoking, such as lung cancer, heart disease, and respiratory problem. So the objective is to create awareness and remind smokers about the serious health risks associated with tobacco use. Next, economic measures also play a major role in reducing smoking rates. The government imposed high excess of taxes on cigarettes to increase their market price. So this strategy is based on the concept price elasticity, where higher price usually lead to lower demand. When cigarettes become more expensive, people are more likely to reduce consumption or stop smoking completely. This strategy especially effective among young people and low-income group because they are more sensitive to price increase. In addition, higher taxes can also increase government revenue, which can be later used to support healthcare service and smoking prevention program. So now we go to the second slide, which is implementation and public support. So beside the regulation and taxation, public awareness and support programs are equally important in ensuring the success of anti-smoking policies. So one of the example is the Tak Nak Merokok campaign, which is aimed to educating society about the danger of smoking through advertisements, schools programs, social media and campaign, also community activities. So the public is constantly reminded about the negative effect of smoking on both smoker and non-smoker. This campaign also encourages healthier lifestyle to help create a culture that discourages smoking. At the same time, the government provides a smoking cessation clinic to support individuals who want to quit smoking. This clinic offers counseling service, health advice, and nicotine replacement therapy to help smokers manage addiction and withdrawal symptoms. Quitting smoking can be difficult because nicotine is highly addictive, and so professional support is important to improve the chances of success. So the implementation of this strategy is coordinated through the multi-level governance framework led by the Ministry of Health. The ministry is responsible for planning national policies, monitoring smoking trend, and ensuring that public health objectives are achieved. Meanwhile, local authority play an important role in enforcing regulation at the community level. For example, they monitor compliance with smoke-free zone and take action against individual or businesses that violated the rules. Non-governmental organizations or NGOs also contribute significantly by conducting educational activities, awareness campaign, and community outreach programs. Their involvement helps strengthen cooperation between the government and society addressing smoking issues. So, in conclusion, the anti-smoking strategies combine regulation, taxation, education, healthcare support, and cooperation between different organizations. Through this combined effort, the government hopes to reduce smoking rate, improve public health, and create a healthier environment for future generations.
Assalamualaikum and hello everyone. My name is Muhammad Haziq Izzuddin bin Muhammad Izwan, and I will continue our presentation with policy evaluation. The National Tobacco Control Policy is an important component of our public health strategy designed to reduce smoking rates and prevent the onset of tobacco-related disease. Through various actions such as stricter law, higher tobacco taxes, educational campaigns, and smoke-free zones, the government hopes to create a healthier environment for the public. Beyond individual health, this policy serves as a critical economic purpose that reducing the massive healthcare costs due to smoking-related illness. However, the success of the policy is determined by a complicated balance of its strong points and persistent operational weaknesses. Our first major strength is the policy's comprehensive strategy. Rather than relying on just one tactic, the government integrates legal, economic, and educational methods. For instance, while high taxes make smoking expensive, we also implement public bans and media campaigns to change social attitudes. This multi-pronged strategy is effective because it addresses smoking from both financial and psychological angles. At the same time, younger generations may avoid smoking because they are exposed to educational programs that explain the dangers of tobacco use. So, if one method fails to reach a specific group, the others serve as a safety net. As a result, this comprehensive approach increases public awareness and strengthens efforts to reduce smoking in society. Second, the policy is highly proactive regarding prevention, specifically among the youth. By strictly banning sales to minors and ensuring hospitals, also schools remain smoke-free, this policy is actively reducing the normalization of smoking in our society. This is not only protects the younger generation from second-hand smoke, but also limits the negative social influences that lead to long-term addiction. Therefore, prevention efforts among youth are extremely important in creating a healthier future generation. So the third one is multi-agency collaboration. The government understands that public health is not the Ministry of Health's job alone. Instead, many different agencies and organizations must work together to ensure the success of the policy. Schools play an important role by providing education and awareness programs about the dangers of smoking, while local councils and law enforcement agencies ensure that businesses and public places follow smoking regulations. This teamwork allows our anti-smoking message to penetrate much deeper into the community than a single agency could do alone. As a result, the anti-smoking message becomes more widespread and difficult to ignore compared to efforts carried out by only one agency alone. However, we also must address with the weaknesses of this policy. So, the first one is being inconsistent enforcement. While bans exist for places like restaurants and pubs, many people ignore them because inspections are rare and penalties are not strict enough. When the public perceive monitoring as weak, they begin to see these laws as optional, which continues to put non-smokers at risk. As a result, non-smokers continue to be exposed to second-hand smoke, which can negatively affect public health and reduce respect for the law. Furthermore, the rise of cheap illegal cigarettes poses a major threat. The economic strategy of the policy relies on high taxes to discourage smoking. However, smuggled cigarettes are sold at much lower prices, allowing smokers to avoid paying these high costs. This doesn't just weaken our health strategy, but it also drains government revenue and provides an easy out for those who should be quitting. In addition, this easy access to illegal cigarettes makes it harder to reduce smoking rates because smokers continue buying cheaper products instead of quitting. We also face the difficult reality of nicotine addiction. Nicotine is highly addictive, and knowledge alone, even with the best awareness campaigns, it is not enough to help someone quit. Factors like stress and social pressures lead to high relapse rates, meaning our smoking rates may decline more slowly than we hope unless we provide better medical and counseling support. This shows that stronger medical treatment, counseling service, and emotional support are needed to help smokers overcome addiction successfully. To conclude, the National Tobacco Control Policy, it has a strong foundation through careful planning, prevention, efforts and cooperation between different agencies. However, its long-term success depends on how effectively the government can overcome these weaknesses. Moving forward, strict law enforcement, stronger anti-smuggling actions, and better smoking cessation support programs are necessary to ensure the policy achieves its goal. So that's all from my part, and I will pass our presentation to the next presenter. Thank you.
Hi, my name is Muhammad Irfan bin Muhammad Zamri, and I will present to you about the several policy recommendation that related to cigarette control in Malaysia. The discussion focused on three main strategies, which is the first one is the Generation Endgame or GEG. Next is stronger cigarette regulation. And lastly is strict enforcement against the illegal cigarette sales in Malaysia. First, let us look at the GEG policy. This policy creates a smoke-free future generation in Malaysia. Under this proposal, individual born after 2008 would never legally allowed to buy cigarette even when they become adults in Malaysia. The Malaysian government introduced this idea because many smokers start to smoking during their teenage years. Once addicted to nicotine, it becomes very difficult to stop. By preventing young people from smoking, so the government hoped to reduce the future smoking rates. For example, if someone born in 2008 turn into 30 years old in the future, they still cannot legally buy cigarette in Malaysia. This policy is designed to slowly reduce the number of smokers generation by generation. This is very important because smoking causes many serious diseases in Malaysia, such as lung cancer, heart disease, and breathing problem. In Malaysia, thousands of deaths every year are linked to cigarette smoking, and the government spent a large amount of money treating smoking related to illness in public hospital. Next is the stronger cigarette regulation. Malaysia already have several policy, but this regulation can be more stronger than before. One example, in increasing cigarette tax, higher cigarette price can reduce smoking, especially among teenagers and low-income group, which is B40 people. From Eastern, when the Malaysian government increased the tax on cigarettes, cigarette price become more expensive, which help to reduce the cigarette consumption among all the consumers in Malaysia. Another example is the one of graphic health on the cigarette packs, especially in Malaysia. We can see the cigarette packaging already show the picture of damaged lungs and smoking related to the disease. This warning helps the public about the danger of smoking and discourage people from starting this habit. The government also introduced a plain packaging discussion where cigarette box would have simple design without attractive branding. This can reduce the influence of marketing, especially on the young people. Finally, let's discuss about the strict enforcement. Even with the strong policy, enforcement is necessary to ensure that people follow all the law. One of the major issues in Malaysia is the sale of illegal or smuggler cigarettes. These cigarettes are often cheaper and easier to access, especially in small shops. Because of the lower price, many smokers continue buying them despite government effort to reduce smoking. For example, enforcement agencies such as Malaysian Custom Department regularly conduct raids to seize illegal cigarette product. The government also impressed fine on the business that sells cigarette without proper license. Another important enforcement policy is the smoking ban in all public areas. In Malaysia, smoking is banned in the restaurant, public transport area, hospital, and many public space. Individuals who smoke in this area can be fined from the enforcement officer. For example, a restaurant owner might display the no smoking area, and customer who smoking may face the penalty. In conclusion, Malaysia uh, can reduce smoking rate with three important strategies in Malaysia. That's all from me. Thank you.
The sources describe the NTCP as a comprehensive and well-structured policy that successfully integrates various instruments to combat tobacco use. While successfully in raising awareness and creating smoke-free zone, its future effectiveness depends on its ability to evolve and address enforcement challenges and the changing landscape of nicotine consumption. In conclusion, the National Tobacco Control Policy or NTCP is an important public health policy that was introduced to reduce smoking rates and protect the health of Malaysians. The policy combines different strategies such as tobacco control laws, public awareness campaigns, smoke-free zone and international cooperation to combat tobacco use effectively. Through these efforts, the NTCP has helped increase public awareness about the dangers of smoking and the harmful effects of secondhand smoke. NTCP remains a comprehensive and well-structured policy that contributes to creating a healthier society, reducing smoking-related illnesses and improving the quality of life for future generations in Malaysia.